So today there are 14 new community cases to report, all in the Auckland region. One of these new cases is recorded at Whakatiwai, and it is a household contact of the earlier reported cases in that household. It is counted in the Auckland totals as that falls under the county's Manukau DHB catchment, and that household is being managed by the Auckland Regional Public Health Service. So that takes our total number of cases in this outbreak to 1,085, and of those, pleasingly, 790 have now recovered. In addition, there's one new case in returnees in managed isolation. Of today's 14 new community cases, only one is considered not linked at this point. Once again, most are household contacts already in isolation, and several others are known close contacts. Investigation into the connections of today's remaining case are ongoing, including the interviews. Back to yesterday's 5 unlinked cases, 4 of those are closely geographically linked to existing households that have cases, and there are strong leads. Just one is still under investigation. Obviously, that lower number of 14 cases today is encouraging, but we do expect the numbers to bounce around a bit. Based on the number of very close contacts we already have in isolation, mostly household contacts, we would expect another 50 or 60 further cases just from that group over the coming week or two. Now, I do want to acknowledge everyone in that upper Hauraki area for their fantastic response yesterday. Nearly 500 swabs were taken at Wharekawa Marae in Whakatiwai yesterday, with more than 400 results back so far, all of those tests negative. Still encouraging anyone in that area to go and get tested if you haven't already. We have testing centres opening today at Wharekawa Marae again, and there were over 100 swabs taken by 11:30 today, and Mangatangi Marae with 38 people already tested by 11:30 today. I also want to strongly encourage people living in that rohi to go and get vaccinated if you haven't already. There are 2 vaccination stations close to the testing centres at EcoQuest Education Foundation in Whakatiwai, and pleasingly we'd had 26 people vaccinated there by late morning. Another vaccination station is at Maramarua Rugby Football Club as well. So today is a great opportunity to get vaccinated. Take your whānau members aged 12 and over with you. Remember, vaccination is free, and we know it is highly protective against becoming very unwell with COVID-19. And finally, today I'd like to note on a positive note, or positive vein, as you would have seen, very early announcement from Pfizer of the results of their trial of the COVID-19 vaccine in children aged 5 to 11, which shows a favourable immune response and safety profile in this age group. Whilst at this stage the information available is limited and the detail is still to come, it is promising news. It was undertaken, this trial, in around 2,000 children. It used lower doses, about a third of the dose used in adults, and given approximately 3 weeks apart. Importantly, it showed a similar antibody response and a similar safety profile to the age group of 16 to 25. Obviously, we will be looking very carefully at those data and when they are available, and we are aware that Pfizer will be submitting the evidence initially to regulators in the US and Europe in the near future. We will be following that process with interest and very closely. We will, of course, follow our usual rigorous regulatory and approval processes here once Pfizer submits the data, and we will do that as quickly as possible when the time comes.
It is pleasing to see a lift in testing across Auckland, with 8,588 swabs taken yesterday, which is a good result for a Monday. But it is critical that we keep up those testing rates. There are 24 community testing centres available for testing across Auckland today. I want to highlight one of those specifically. We have a new pop-up testing centre at the Manukau Sports Bowl at 1 Boundary Road in Clover Park, a new suburb of interest, which you would have heard me talk about yesterday. We are encouraging everyone in the Clover Park neighbourhood to go down to the Sports Bowl today to get tested so that we can be sure there isn't further transmission in your area. I'll say that again. Based on a set of cases that we have in Clover Park that we believe there is a geographical relationship between, we are asking everyone in Clover Park to be tested. This is a rigorous and cautious approach. In addition, if you are a contact or have visited a location of interest at the relevant dates of time, or you're connected to one of the 8 new suburbs of interest and have symptoms, even mild ones, please get tested and isolate at home till you get your results. Throughout our COVID work and our success has been really based on the fact that people by and large have been really compliant. And that's meant on a number of occasions now we've been able to manage the virus successfully. However, there has been the odd person that has broken the rules and put others at risk. Specifically, we've had some people break out of MIQ, including in a handful of cases with COVID, who have posed a threat to the community. Once we put fines in place for this group, we saw the numbers attempting to escape did reduce. And you remember very early on we had some issues in this regard when we first established managed isolation. But each breach of the rules risks COVID spreading, so it's important the penalties reflect the seriousness of the actions. I should add, this is an issue that ministers have been working on for some time. You'll recall when we first introduced our infringement fee for COVID orders, they've been set at $300, and where that fine is being imposed by the court, it's risen to $1,000. It's Cabinet's view that these fees don't properly reflect the significant social and economic impacts of a single case of COVID-19 getting out in the community, and nor do they act as a sufficient incentive to play by the rules. And that's why the maximum infringement fee will move from $300 to $4,000 for individuals. For companies, the maximum will go from $300 to $12,000. Where those fines are imposed by the courts, the maximum fine for individuals will move from $1,000 to $12,000, and for companies from $1,000 to $15,000. Again, those are maximums, and of course the court will use their discretion and take into account circumstances in order to use that fees regime. These changes will take effect as early as November 2021, subject to the passing of the COVID-19 Public Health Response Amendment Bill, and has really been in response to people view that we didn't quite have an infringement regime that reflected the severity of breaches that we have often dealt with. If you're a level 3 worker returning to a workplace and you're not yet vaccinated, I've got a specific request for you today. Get your first dose this afternoon before you go back to work, and there's a number of ways that you can. This will provide you with a crucial layer of protection in level 3, not just for you but your workmates and those who may visit you as part of your work. So far, we've had 1,132,510 Aucklanders who have now had their first dose, which represents 79% of the city's population. And I'm eligible population, and I'm hopeful that we'll get to 80% very, very shortly. But every remaining unvaccinated person is a risk and poses risk, so my challenge to Auckland is now this. Let's keep going. Let's see if we can get to 90% by the time that Cabinet considers our alert level 3 settings in 2 weeks' time. Now that is an ambitious challenge, but it is doable. I've seen modelling which suggests that if we go hard and do this right, we can reach that goal, but it will require a team effort. It means that getting the vaccine yourself is not enough. You need to encourage and help others to do the same, whether it's answering their questions, supporting them to find information, or helping with a booking. If you're looking for somewhere to get a vaccine this afternoon, there are walk-ins and drive-through options right across the city. You'll find them at healthpoint.co.nz. Another 20 GP clinics went live in Auckland last week, so we've now got 135 GP clinics and another 25 expected to start this week. There are 62 Auckland pharmacies, and we're onboarding more of those as well. And today, New Zealand Post is giving its staff, contractors, whānau and members of the public the opportunity to be vaccinated at a drive-through clinic at its Auckland Mail Centre in Highbrook. We've also seen great momentum in our Pacific vaccination efforts, and so just for today, for this slot, I thought I'd highlight just a few of those Pacific vaccination efforts in our Pacifica community. There's a pop-up event today at the Te Aratu Samoan Methodist Church. On Thursday, a Nuean vaccination pop-up will be held at the Church of Latter-day Saints in Mangere, led by the whono. On Thursday, Friday and Saturday, South Seas Healthcare in the Otara Town Centre is setting up a Cook Island vaccination pop-up. On Friday, there will be a Samoan vaccination pop-up held at the Mangere Town Centre, led by Beta Drive Doctors, South Point Doctors and HealthStar Pacific Trust. These are just some really specific initiatives I thought I'd highlight, and I'll try to do a little bit more of that over future 1 o'clock updates. So then it's up to all of us to get out there, to get vaccinated and keep those goals in our sights.